there's an abuse of power. The state forces can come up with fabricated charges. Persons who are arrested undergo torture. Torture is always a tool.
I'm Edel from the Medical Action Group, and you are welcome to the main office of the Medical Action Group. We are in Quezon City right now, and this is our, we call the main office because there are a lot of offices that Medical Action Group. You know for a fact that the Philippines is a 7,100 islands, and we have about 4 to 5 offices outside of Metro Manila. So come.
Well, Medical Action Group is a non-stock, non-profit, non-government organization in the Philippines, primarily established for the promotion of the right to health of the Filipino and all citizens in the world. We focus our services in addressing the health impact of torture, extrajudicial killings, and enforced disappearance. So from simply providing direct medical services to victims and extending healthcare services to communities, MAG has developed 5 major programs and which still existing until now. One is the policy advocacy program. 2 is the capacity building and training program for doctors. And 3 is the documentation. 4, again, the direct assistance program through our clinic operations and medical missions. Then 5 is our membership development program. These programs actually embodied the very missions of the organizations, which is the promotion of the right to health for all, and giving premium to the need of those who are who have less in life and have experienced worse in life, including those who have been victim of human rights violations.
And then I will show you the clinic. This is the clinic of the doctor, medical doctor, where he conducts interview, also provide treatments.
Almost majority of the cases that we've been committing are drug related, but in reality, these guys are not part of any drug, illegal drug peddling or using. They are just being added to the number that you would like to show to the people that drug is a big problem in the Philippines, because they have this quota system, a quota and reward system, that if you have lots of people apprehended because of illegal drug, they are rewarded. We can't allow this kind of injustices to happen to people if we will not document who will. Because we know very well that, you know, the police and the government, medico-legal, this is a syndicate. Whatever the police will say, that what will, you know, this medical legal practitioners of the government will say. So there's a need for us, independent groups, to come in and really document what's the real and how help these people, helpless people, to get justice.
There's an abuse of power. The government, especially the state forces, can accuse anyone, can come up with fabricated charges that can put anyone in detentions, and even suffered in detention for years without trials, without hearing, or even much more or much less having a resolution of the case. It also reflects how our justice system works, the miscarriage of justice. Considering that most of our clients are considered poor, coming from the poor sectors. They don't have any access to legal services. They don't have money to support their case. They can only rely with the support of non-government organizations like MAG. Many political prisoners are languishing in jail until this time because of this trump-up charges.
After the clinic is the service program office, so that they are all compact in another, all in one space, no? And Roger Salabad, our psychologist, and our social worker, Tiffany Haban.
Currently working on the psych reports from our recent jail visit. So after doing this, I will be sending this to, I will be giving my recommendations on what intervention should be given to these clients. Some will be, if deemed that they need a further intervention, they will be referred to our psychiatrists or psychologists for further therapy and counseling.
We're looking at the database of our telemedicine. We actually now have 170 clients who availed our telemedicine. The telemedicine is just simply a remote check-up or availing of medical services and psychological services remotely through telephone call, email, and other digital communications. Because by using the telemedicine, we can now still provide services to our clients outside Metro Manila.
Come to our clinic, our dental clinic, where our dentist is always available. As a human rights organization, we conduct dental documentation. Sometimes they are arrested and cannot be found, and only found through a few days after, and then they have to have things that can identify them. And also sometimes for the purpose of torture, sometimes it's part of the torture method being used to them. They are their teeth are being pulled out, and so just to prove that this there is a dental torture to one person, we have to show that this is before and after.
In the Philippines, telling the truth is really a challenge because we are in a society wherein people telling the truth are being criticized, are being tagged as communists. So it's still a challenge for us. That's why very few people are into this kind of work that they are doing because they don't want to risk their lives. On top of that, there's no money in this kind of work because we are serving the people, the impoverished people. And there's no reward for doing that.
In Tagalog, we have this kind of value called malasakit. That is having empathy towards others. When it comes to MAG, it is an expression of our ethical principles, the do no harm, the do no good, democratic code, that we have to provide our services to everyone, to anyone, especially those who are in need. And that's what actually motivates our doctors. That's what motivates our staff. That despite of a very traumatic, hostile environment that we're working on, we know that we are gaining some grounds. We're improving a lot. And we're saving a lot of people. Saving lives for that matter.